Hank wants a sidebar now. Why, Hank? You struggling a little bit?
Good afternoon, Dr. Laposata.
6 minutes till the afternoon.
Based on your analysis, was Mr. O'Keefe thrust backwards? Is that what you determined looking at his head injury?
That he was, I didn't understand you had your hand in front of your mouth.
Sure, I'm sorry.
Yeah.
You don't have any neurological expertise, do you?
I'm not a neurologist. I'm not a neurosurgeon. I'm a forensic pathologist.
It's such a role reversal, isn't it? All this contempt that Brennan has been spewing all over these witnesses in this courtroom.
Subdermal hemorrhages?
Subdural hemorrhages.
You know the step-by-step process that they would undertake?
To do what?
To try to operate or save somebody from a head injury.
The belittling, the treating them like they're idiots. Oh, how the tables have turned.
There are a number of different steps that a neurosurgeon can take when someone suffers acute brain trauma to try to save the person, isn't there?
Well, the job of any doctor is to try to save a human life.
How many times in your career do you think that you've assisted the help of neurosurgeons to take a look at brain study to help you?
I've never needed to speak with a neurosurgeon to look at a brain.
So it's not a clinical setting or a clinical experience of actually watching the brain at work and seeing the injury as it progresses?
We don't do neuropathology like that on living people. The person is deceased.
She isn't afraid at all to show us how dumb she thinks a lot of this is.
In fact, every day when people get the right attention or proper attention, they're brought to level 1 trauma centers around this country to try to help them or save them. Isn't that fair to say?
I would hope so.
You looked at Mr. O'Keefe's brain. Obviously, it's after he already expired, correct?
Obviously.
Have you ever heard of a Guzman coma score?
Glasgow, you mean?
No, this is Glasgow, but you've heard of Guzman?
It's called Glasgow coma score.
You don't even know what these words are that you're using in your cross-examination.
Many people who suffer coup will go into a brain surgeon center, and many of them pass after time, don't they?
Now, every case is different.
Right. Many people can't be saved. Did you know that about 1/3 of them do get saved?
I don't know what you're talking about. 1/3 of everybody has different sorts of injuries. 1/3 of what?
Just feeding it right back to him.
With a Clavis fracture, coup. Are you aware that 1/3 of those patients survive if they get the proper treatment?
It depends on the amount of force.
Okay. Have you read any studies that tell you with the proper treatment, despite these potentially catastrophic injuries, that 1/3 of patients can survive?
No, but that's not the case we have here.